Hello, and welcome to today's webinar on innovation and quality in public health. My name is Kathleen Amos, and I am the Assistant Director for Academic Practice Linkages at the Public Health Foundation. And I'm joined here today by Gary Cox, Executive Director for the Oklahoma City County Health Department. And on behalf of our team here at the Public Health Foundation, I'd like to first thank the Centers for Disease Control and Prevention for making this event possible, and also thank all of you for joining us today. We're thrilled to have so many of you with us for this exciting look at how public health can position itself and its work as innovative, and how public health organizations can assume a vital role as the community chief health strategist, bringing together diverse community players to make meaningful progress on community health issues. Before we get started today, we would like to go over a few housekeeping items for today's webinar. On the slide, you can see an image of the attendee control panel, which you should see on the right side of your computer screen. First, we wanted to let you know that all attendees are currently muted. In the control panel, you should see an audio section. For audio, you have the option of listening through your computer speakers or calling in on a phone. If you are using your phone, please choose the phone call option and enter your audio PIN. If you are using your computer speakers, please choose the computer audio option. The slides for today's presentation are available for download in the handout section of your control panel. Throughout the webinar, please submit your questions or comments via the questions box in your control panel. Please feel free to send in your questions for the presenter at any time, and we will collect and address them during the Q&A session at the end. And finally, this webinar is being recorded, and the archive will be available following the webinar to you and others who are unable to join us today. So before we really dive into the presentation, I wanted to just say a few words about PHF. The Public Health Foundation is a national nonprofit organization based in Washington, D.C., and we exist to serve the public health workforce and to improve the public health by strengthening the quality and performance of public health practice. We provide resources and tools, training, and technical assistance nationwide, and we focus specifically on three areas: workforce development, quality improvement, and performance management. So with that, I'm pleased to introduce you to our speaker for today's webinar, Gary Cox. Mr. Cox is the Executive Director for the Oklahoma City County Health Department in Oklahoma City, Oklahoma, and a visiting associate professor at the University of Oklahoma College of Public Health. A leader in public health, Mr. Cox brings more than 35 years of public health experience to the Oklahoma City County Health Department and has previously served as president of both the Oklahoma Public Health Association and the National Association of County and City Health Officials. Mr. Cox has dedicated his career to improving health, raising awareness about health issues across multiple sectors, and committing to developing and leveraging private and public partnerships to improve community health outcomes. He is committed to a culture of continuous quality improvement and has consistently supported transparent and accountable governance in local health department activities, evidenced by the Oklahoma City County Health Department's designation as one of the first local health departments to pursue and achieve national accreditation. Welcome, Gary.
Thank you very much, and good afternoon to everyone. And we appreciate this opportunity to share some of our successes and some of our challenges here at the Oklahoma City County Health Department, and also realize and know that there's much good work going on at the state and local and national level in public health in our country. And so we'll share with you some of the things that we've done that have been successful, and also some challenges as well. We'll kind of start out, and we're actually going through a process now in Oklahoma that several other states have gone through, and that is a modernization, a look at modernizing our public health system, and how can we look at our system and see what's working, what things can we improve and make better. And I know many other states have gone through this process, Oregon, Washington State, and others. And so really one of the places that we've kind of started with, and others have as well, is looking at this from the standpoint of what kind of services, foundational capabilities and services should every person in Oklahoma have available to them from either their county health department or their metro health department or their state health department. And so you can see in the black box there there's a list of some of those foundational services that we think everyone should have available to them. Also, on the left-hand side of the slide, you'll see how public health is really the hub of the wheel, and all of the different partners and folks that are involved in improving health in our community and our state. And so we rely on all of them to really have success in our community. I know there's a lot of work that's been done around local health departments as the chief health strategist and public health 3.0. And really some of the things that we're trying to implement here revolve around investing in innovation and best practices. How do we work not only with traditional partners that we work with in public health, but in non-traditional partners as well? How do we take a look at not only just the medical system and the public health system, but the broader upstream approaches to improving population health? And how do we gather information that's relevant to improving public health and have that data available in real time and as needed? Well, you know, we try to make our decisions based upon data-driven decision making, and we gather a multitude of data and around this issue, the community health needs assessment, which I know most health departments do, which we use to develop a strategic plan. And then, of course, partnerships are critically important as well. And then measurable health improvement is really what we're looking for. So we really want to take a multi-pronged approach to community-wide health. And so this approach includes inspiring patients to take action on their own health, but using technology to identify and to track patients in need of health management to prevent disease. And so we also recognize that in order for patients to be healthy, their community must promote health and prioritize health with their own community. We'll talk about how we use data, some examples of that, but one example is where we're sitting now is our campus, and we did our community health assessment a few years back, found that this was the lowest performing health zip code in our city and our county, and we brought together a group of partners in our campus to really bring a rich abundance of resources to an underserved community that's really worked to improve health in our area. Well, one of the ways that we use data and collect data is what we call our wellness score, and it's going to be kind of a summary of our overall community health status. And it's the basis of how we make decisions and how our partners make decisions, elected officials make decisions in our community. We work closely with our other metro department here in Oklahoma, the Tulsa Health Department, and we coordinate our efforts to have city-county-wide improvement in health outcomes. And so we know that by understanding the needs of the community, we have to have that information in order to make targeted community interventions that are effective and are pointed towards improving health. And of course, we have to work with our many partners to gather this information. And it's based upon about not only mortality information, morbidity information, but about 20 plus other community indicators, from poverty to crime to many social and behavioral issues that we fold into that score. And it's done zip code by zip code, which we'll give you an example of. This is really an example of one of the things that we look at in this wellness score report, and it's available on our webpage, by the way. So if you want to look at it in more detail, anybody in our community or nationwide can take a look at it. This is one example, life expectancy in Oklahoma City County, and it also shows one of our great challenges that we have here. The average age in Oklahoma City and County is about 75, and of course that's about over 3 years less than the United States, so a real challenge there. But the thing that's really disturbing is if you compare the life expectancy to the better performing zip codes as opposed to the poorest performing zip codes in life expectancy, you see a variance from about 64 years to 80, almost 82 years. And so in our own community, we have a difference of 18 years in lifespan. And so that means that possibly just because of the place that a child is born in a certain part of our city can affect their life expectancy. And so, as we all know in public health, place does matter. This is clearly not acceptable. And so we really have to look at ways to first inform the community of this, and second of all, come together with solutions to narrow that disparity and eventually to eliminate that disparity. And you can see here in the slide that the lighter colored greens are those areas that have better life expectancy, and those tend to be more in the suburban areas. And then in the urban core, you see the darker green, where those life expectancies tend to be lower. Well, as we all know in public health, it takes partnerships to get our work done. That's our lifeblood, and that's how we have to operate to maintain an effectiveness. And so, if these are just some of the many partnerships that we have here in Oklahoma City. Some are traditional and some are not traditional. For example, we have one partnership with the Oklahoma City Energy, and we have actually their practice fields, which is a professional soccer club. We have their practice fields right here on our campus. They were funded in part by Blue Cross Blue Shield of Oklahoma and some others. And actually, not only do they practice there, but those soccer players, it's an opportunity for kids and sports teams to come and be mentored and be physically active on our campus. And so that's a bit of a non-traditional partner. We also have a partnership with the Oklahoma City Thunder, which is, of course, our professional basketball team. And we have some Thunder Up courts where, again, kids could come and be physically active as well. We have a mobile market and a very untraditional partner for public health. There's Oklahoma Beverage Association. They donated that vehicle to us, and we're able to deliver healthy foods for those that are where fresh fruits and vegetables are not available in our community. I guess another activity where we try to bring people both to be physically active and just to be aware of some of our services is the open streets that we sponsor with many partners. That's held twice a year. And we've had 3 of those events so far with over 50,000 in attendance. So from a public health perspective, to get folks out and involved in and exposed to healthy eating, to some of the preventive services that we have and our partners have, we think has been a good success. Certainly, program performance and strategy is important, and here in Oklahoma, we've continued to see a growing budget deficit in our state, as many other states have experienced as well, resulting in some funding cuts, which makes it a bit more challenging. And so we really take our role seriously about trying to expand partnerships, about trying to be innovative and to be cost effective in our programming. And using many of these tools really helps us to be to get that job done a lot more efficiently and effectively. We do have a quality improvement council. We have a data and grants evaluation administrator that's spearheaded a system that aligned with the health department's strategic plan and program development. We have a data-driven performance improvement team, and they've sought to create a culture where standardized metrics were intentionally followed by all of our programs across the agency. And of course, many of these tools are funded by CDC to the Public Health Foundation and are available for local health departments, and we use them extensively here. And we think it's very important to use them to have a true sense of innovation and forward-thinking activities. Well, this is just an example. I know many of you have a strategic map, a strategic plan. As the old saying goes, if you don't know where you're going, almost any road will get you there. And so we want to be purposeful and follow data and follow the community input and the community priorities, and really be focused on our finite resources in order to improve health, working with others in our community. We have each priority area of our strategic plan is monitored and is reported. And as a matter of fact, it's addressed at least once per quarter with our Board of Health. We have a report to them on our progress for each and every metric that we are following. And so it's basically a dashboard reporting system that you see here. Well, with the robust strategic plan, and we do have a growing population here in Oklahoma County. As a matter of fact, Oklahoma City's population grew by about 7%, about twice what the national rate is from 2013 to 2015. So we really have to have a high quality care to our growing community, and we have to have innovative strategies and extended partner, traditional partner, and non-traditional partner engagement in order to make positive growth and positive outcomes here in our city and in our county. Well, this is an example here of our wellness score, which is a zip code by zip code level analysis. And we're able to identify indicators with the most consistency across these zip codes, as well as program opportunities. And so you see some examples here of income disparity in the green, of crime, and of mental health visits in our community zip code by zip code. And we, of course, use these to make our decisions and where to allocate our resources. Well, this is just one example of what we've tried to do to try to I guess, narrow the gap between health care and public health. And in this world, changing world of health care, what is our relevancy in public health, and how do we interact with the healthcare system? This is one of the ways that we've tried to do that. We institute a pilot program here with two of our medical systems, hospitals, and we actually placed two community health workers, and the hospital requested bilingual community health workers in the emergency rooms, and they were assigned a caseload by the hospitals of their frequent flyers, of folks that use the emergency room very often and were very challenging cases for them and very, very expensive cases. So this is a one-year pilot, and it shows, basically that the reduction in emergency room visits from the historical year was about 56%, over $4,100 per client savings, and we had almost 70% of the clients reported 0 visits to the emergency department by the fourth quarter of the year. And so I think this showed the hospitals and medical systems a way that public health can interact with them and can be effective by working with these patients and by case managing them, referring them to community resources, getting them linked to physician care, and generally helping them to become knowledgeable about how to access the medical care system. So using these hospital utilization rates provide insight into which pockets in our community have increased needs for health services so that we can begin to shift resources and help others shift resources to those areas. Well, we'll try to give you another example of innovative strategy. We applied for an accountable community grant. We were fortunate to be able to get that grant. I think around 34, 35 grants were issued nationally. And so the overall goal, and you see the operational structure here, but actually the two metro health departments decided to go together and work with the state health information exchange and My Health to try to get this grant, which we fortunately were successful in. And this would cover, actually, it covers half the population of the state of Oklahoma, so it should have a significant impact. And so we're broadly screening, not only for health, but we're broadly screening for health-related social needs, so it's a little bit different focus. And we're assembling a community resource inventory, and then we're going to implement a health navigation service to help the highest risk patients address their upstream causes of poor health or their social needs. And we'll be hiring in each community 7 navigators, and they will be focusing actually on 5 core health-related social need resources. Some of the upstream causes of poor health, including housing insecurity, food insecurity, utility assistance, interpersonal violence, and transportation needs. And so that program is just being underway, and we're looking forward to seeing some positive results there. Well, community integrated care. How do we go about it here? And this is not the way everybody goes about it, but we look at the data and we find out where the challenges are, and then we try to shift resources to those areas. We do have actually a campus where we're sitting now, but it's not just a place for us to provide public health services, but it's also a place for partners to come together. So, for example, we have the food bank, we have the YWCA for domestic abuse, we have legal aid if they have landlord-tenant issues or something of that nature. We partner with OU Medicine for primary care and for behavioral health services. So, and then there's opportunities for them to be physically active here. We have a community garden. So we have an extension service, an agricultural extension service here that has master gardeners available and others. And so it's a wide variety of services that are available in our community, and we place it in the area, the most challenged health area in our community. That's the zip code that we're in here, 73111. We have a higher rate of mental health visits, and so we have many partners that help address those needs. You also see if you look on the right bottom, that's an aerial of this campus and how that layout is. If you look at the top right, you'll see our wellness score reports that actually health outcomes have improved in this area over the 3-year period. We had over 36,000 visits to this campus, and of course that's not just the work of the health department, but many partners and hospitals and other partners that are working to improve health. The top right-hand side shows you the further development. Now, the greatest need now that this has improved in Northeast Oklahoma City, the greatest challenge is in South Oklahoma City. And so we are trying to duplicate our effort there, and that campus is under construction now, and it looks like we're going to be able to occupy and provide services there in that area of great need sometime in July of this year. And you'll see on the left-hand part of the slide, you'll see the circle there, and that is a zip code where we put our first campus to provide services. Well, we do try to have clinical integration, and so we're not talking about co-location only, but trying to work with the patient on an integrated system using partners. We do the public health services, and we have partners that do primary care and do behavioral health, and they're all working together with these patients and with their families and with the communities that they come from to actually improve their health. Well, better economy through public health engagement. And so we're really talking about our Wellness Now Coalition. And I came to the Oklahoma City County Health Department in October of 2009, and in the spring of 2010, our mayor and county commissioner, chairman of our county commissioner, since we are a city-county organization, kicked off a wellness coalition called Wellness Now. At that time, it only consisted of a handful of folks, and now it's grown to over 300 partners. And actually, it's community-driven. What we do is actually we have folks that staff those different groups and those different committees. But actually, we just provide the data, and we provide the evaluation and the staffing. They talk about priorities, they set the priorities, and then they help to bring partners to the table to implement their priorities and their plan. And they do have their own plan, which very closely corresponds to our strategic plan as well. And so using data and working across sectors, they're helping to improve health. I can just give you one example of that. We had one of our foundations that came to us and said, well, we're really interested in reducing teen pregnancy in our community. So how can we work with the health department? And we said, well, come to our coalition meeting and make a presentation about what you would like to do, and let's see what the coalition says. They did, and they presented. The coalition voted to create a work group called Adolescent Health. And as a result of that, they began meeting, and they decided to apply for a grant, and they applied for a teen pregnancy prevention grant. And they asked the health department to be the grantee, and then a lot of those funds were subcontracted out to community members who were involved in that effort. And so as a result of that, we've had I'd say a substantial reduction in teen pregnancy since that effort has been underway. So that's the power of partnerships and coming together as a community to make a difference. I think one of the things that we have done is we have looked through our community health assessments and our wellness score to look at where we're making progress and where we have room for improvement. And we're making improvement in Oklahoma County on almost all fronts. For example, strokes mortality is down about 14%. Overall mortality is down about 4%, and that's the work of a lot of people working together, our healthcare system as well as our public health systems included. And so all of the indicators are good, but there's a couple that are not good. And so one of those was unintentional or accidental unintentional mortality. So we started drilling down into that, and what we found out was when we looked at it closer, it was really drug overdose and really boiled back to opioids. And so we've actually got several groups that are working in our community now, and we've sought a couple of grants, and we're thinking about how we can become involved in the criminal justice reform issue, and how we can get folks that are in the criminal justice system that really have either a substance abuse or an alcohol problem or a mental health problem out of that system and into a system of getting help, and not only just counseling help, but let's look at their housing, let's look at their job situation. Do they have transportation? Do they have domestic violence? Do they have food insecurity? Looking at all those instances so that we can keep them, reintegrate them into our society where they are productive members of our society. And as we know, 95% of the folks that are in the criminal justice system are going to return to the community, and so they are part of an important part of our community, and we want them to be healthy and a contributing part, and we certainly want to reduce the amount of drug overdoses and the illegal opioid use that we have. So I think that's one of the things that we're involved in, and it's how we're using our data to be able to focus where our efforts need to be to further improve health in our community. Well, let's see, I'm going to go back one more here. Opportunities for continued improvement, and the opioid epidemic is certainly one. Criminal justice reform is related to that. But that's something that some health departments are involved in. I think it's a ripe area. We really have, I think we can bring the public health, the way we do business in public health, and the data piece of it, and the evaluation piece, and bringing partners together, that we can be a really important part of that. Certainly by getting real-time data and sharing that data with all of our partners and with the community in general, we can drive good sound decision making in our community. To continue to invest in innovation, because looking at new ways of doing business and better ways of doing business, using our resources more effectively, I think is going to be something that's going to be appealing to taxpayers and to elected officials in our community. And I think recognizing the importance of the connection between education and health, and how they are codependent on each other, and how important prioritizing education is, because we know from the evidence that folks that graduate from high school are going to have better health outcomes. We also know that kids have to be healthy in order to be successful in school. And we also know that by putting an emphasis on health and wellness and education, that's going to contribute to better jobs, better paying jobs, and all of that is going to work together to have a more vibrant and a healthy, well community. And so we have many opportunities, we have many challenges. We want to celebrate our successes, but we know that we've got a lot of work to do here in Oklahoma, and we've got a lot of work to do about keeping public health relevant to our communities to get that continued support as being vital players, actually indispensable players in protecting and improving health in our communities. So we know that, again, that you are doing a lot of work in your communities, and you have your challenges and successes just as we do, and we'll all keep working together for the good of public health in our communities, in our state, and in our country. So we appreciate your attendance here today, and we will close up this and go to the next phase of questions.
Thank you, Gary, for that fantastic presentation. As Gary mentioned, we would like to now open the floor for questions. And as a reminder, please feel free to type your questions into the questions box, and we'll do our best to address as many as possible today. So we do have a few questions in the questions box already. I guess our first is more a comment than a question, and I think relates to your talk, Gary, about modernization process. So someone made the observation that Massachusetts is currently going through this process as well. And then our first question is, because of your partnership with the Oklahoma Beverage Association, are you asked to promote any sugar-sweetened beverages via the vehicle you use for your mobile market or any other promotion you do?
Well, that's a great question, and no, we are not. And what we found, and I know this is very non-traditional, but what we have found is, because traditionally we've been on opposite sides of the fence, so what we've come to the conclusion in working with them is there's certain things we can agree on and certain areas that we will have disagreement. And so we just try to find as much common ground as we can. And so that's kind of how we've done it. And so far it's worked out well. We haven't backed off any of our principles, and we're still involved in advocating for healthy foods and healthy drinks. But I think too the industry is moving in that direction because they know that that's what the public wants. So I think what the public wants and what public health wants is driving that industry to change. And if we can find areas of common agreement, then it's better to have a willing partner instead of an opponent.
Great, thank you. Our next question relates to QI, and is, what is the quality improvement framework being used at Oklahoma City?
Okay, a great question. We have QI teams, and they are from cross sectors of our department here, from different departments, and basically they set their own agenda. So if an employee comes to them, or if they see something that they think they could, a process that they think they can take a look at and perhaps improve, then they have the flexibility to go do that on their own. And then once they study that and they come to our leadership group and make a recommendation, I can just tell you from experience, I can't think of any recommendation that they've made that leadership team has not supported.
Great, thank you. Our next question, do you have a team dedicated to data collection, analysis, and presentation? Yes, we do. And the primary responsibility for that goes with our epidemiology department. But they also work with city departments, city planning, and a number of other partners in our community, the police department, our ambulance service, emergency ambulance service, and many others. And so we have an internal team, and then they have expanded that to an external team to gather a great variety of data, quite frankly, that sometimes is not easy to get. But they've done a great job at doing that. Great, thank you. We have a question about access to care. So starting with a comment that you've made great advances in improving the structure for improving access to care. What is the insured, uninsured ratio in the Oklahoma City population, and what role does that play in people participating in the initiatives you've described? Another good question. Well, Oklahoma is one of the states that did not expand Medicaid, and so our uninsured rate is higher. I think it's around 13%. That was my last recollection, and so that is a real challenge. And so it has put quite a burden on our FQHCs, our free clinics in our community, and quite frankly on the health department and some of our partners as well. So it is a challenge. And so I'm real proud of the effort of the community that even in light of the high rate of uninsured,
in our state, in our county here, we've still been able to make improvements in health outcomes. So I think it's a little harder to do that, but we're fortunately in most areas still having some success.
Great, thank you. Here's maybe a big picture question. What is the one thing that as a health department director and chief health strategist you do differently than if you were only the health director?
I think, well, just the one thing. That's a tough question.
Or it could be more than one.
Well, I mean, certainly, I think I could think of a couple of things, well, 2 or 3 things, really. One is really the importance of gathering as much real-time data as you can and using that. Secondly, is building strong partnerships. And I think really the underlying thing, the third thing, would be building a strong public health team of your staff that has a sense of urgency in improving health and is open to innovation and doing things better and more efficiently, which we fortunately have all 3 of those. Great.
And I think we have several questions that kind of relate to the same theme, so maybe I'll throw a couple of them out here. What are the most important considerations for fostering a culture of innovation in your agency?
I think embracing the concept of quality improvement and implement it in such a way that we have staff buy into that process, that if they do see something that could be improved, they have the permission to work on that and to improve it. I think too, just being open to opportunity, having an open mind, and I know kind of the way we do it here is with sectors that public health maybe not be traditional partners to public health. We just invite them to our campus and we just sit down and talk. And we talk about, we want to find out what they're doing, what's in their world. And then we explain to them some of the problems and some of the data and some of the things that we're involved in. And then we just simply talk about, are there some ways that we can work together to improve the health of our community? And I don't think, and we've literally had hundreds of these discussions, and I can't really think of one that didn't come away with a positive way of saying, here's something we can work on together for the good of the community. And so I think we've been very, very fortunate in that respect of folks that are they're willing to try new ideas, to work together, and to be innovative.
Great. Do you have any lessons learned or tips you could share for other local health departments that are considering going through the public health modernization process?
You're going to get some pushback. I can tell you that. And we are, because quite frankly, some people just like the status quo, think things are nothing wrong with the system that we currently have, and are really not willing to take a serious look at how we can improve it. So there will be some fear, there will be some apprehension about the unknown, but I think the way we started the process was with the idea that there's nothing that we're going to recommend that's not going to work towards improving a system to improve health in our state. And we've really tried to stay true to that. But I mean, some people question motivations, but we really try to stay true to the fact that we're really all in this to improve health. And that may or may not involve changing the way we do business, changing our system, and improving what we do, taking a hard look at it. But but it's a challenging, it's fun, but it's very challenging. But we look at it as an opportunity. It's a great opportunity to improve what we're doing, to be more relevant in how we go about our business, and bottom line, improve health.
Great, thank you. You actually just answered a 2-in-1 there, because the next question was, what kind of pushback did you get from political leaders, and how did you handle that? So I think kind of hit 2 birds with 1 stone. Are there any innovations you've tried in Oklahoma City that were not successful? Given sparse resources in public health, it's really important to learn from what people have tried so far.
That's a good question. I think one of our challenges, and we're still working on this, is when we hired a private vendor to develop electronic medical records for public health patients, and then trying to take that system and expand that system to basically blend it with hospital records and with the broader medical records, healthcare records. And so not many folks have done that, and working through that has been a much longer process about getting real-time data and what we call a sandbox, a community health sandbox. In other words, a collection of data within certain metrics that we feel is important for us to know what's going on in our community. So it'd be kind of a real-time community health assessment. That's been a real challenge, and we're still working on it, and but we're just not there yet.
Thank you. Earlier in your presentation, you mentioned partnerships. How have you taken innovative approaches with insurance companies or other sectors?
Well, I think one is some of the insurance companies have helped to fund some of the facilities, some of the infrastructure of the department, and so in other words, they have been partners in funding walking trails and soccer fields and physical activity stations and basketball courts that are for use of the community. And they've been both the insurance companies and the medical systems have been instrumental in those partnerships. Or perhaps it may not be them directly, but it could be their foundations that are doing that work. And so we are working with the insurance companies, for example, and we've not accomplished this yet, of trying to get so that they recognize community health workers as a reimbursable expense for public health. And we've not been successful in that area yet, but that's something that we're working on.
Great, thank you. Sticking with the theme of partnerships for a minute, in regards to partnerships like the Beverage Association, Oklahoma City Thunder, did you approach them or did they approach you about partnering? If your department initiated the partnership, how did you go about doing that?
Yeah, it's a good question. It's a mixture of things. Sometimes we've got our strategic plan and we're trying to accomplish certain things, and so sometimes we will approach them. For example, the hospital system, we did approach them. I'll tell you how we do it. A lot of times I report to a 9-member board of health, and these are folks that are very active in the community. They have a lot of relationships in the community, and quite frankly, we use our board of health as kind of an intro to some of the folks that they know, and they set up a meeting, and then we go talk about our mutual interests and how we can work together. That, I think, using the board of health has probably been one of the primary ways that we've been able to engage partners. And then I think the other ways are just the elected officials and their relationships and some of the relationships that they bring to the table. And then some partners we just seek out on our own as well.
Thank you. Getting into some specifics, is there a formal process for people to submit QI requests to the QI teams that you have?
Yes, there is a formal process, and they can self-report those, and those are all considered by the team as well.
Great. Another one here. How do you overcome the difficulties in acquiring data specific to small geographic pockets? And the statement given is that many of our partners are not interested in sharing health and socioeconomic data with us at a level that can be useful in community planning because it could potentially identify small groups, families, etc.
Yeah, that's an interesting question. I don't think that we have come into I don't think that that's been a problem. At least that's not one that I've heard about anyway. I know just by collecting the sheer volume of the number of partners that we're collecting data from is not easy. It's a challenge, but I can't think of anything that we put in our wellness score reports or in our community health assessment reports that are of a small enough population group that we've had to be concerned about identifying individuals. So if that's been a problem, I've just not heard about it. But I think it's a great question, and I can see how in some sparsely populated areas that could be an issue. And the only way I can think of that you could get around that is to more broadly define that population so that it's not as specific.
Thank you. Another follow-up question related to partnerships. Have you worked with chambers of commerce at all?
Excellent question, and yes, we have. We're actually members of the major chambers of commerce in our community, the Metro Chamber, the African American Chamber, and the Hispanic Chamber of Commerce, and many of the suburban areas that we deal with. We're actually members. We attend those meetings. We interact with the business community. We tell them what we're doing, and then we try to get input back from them. And so it's really about building relationships, and this is where you get many of your contacts. So we just try to build relationships in the community. And again, many of these business leaders are influential, they're well connected, and they can put you into contact with a lot of people that might help you to do your job. We've also had extensive relationships with the United States Chamber of Commerce Foundation, and they've come into our community, and we've gotten groups of CEOs together to talk about health issues, and we're working with the U.S. Chamber Foundation as well in some of their regional work. So I think the business community is one of the most important communities to work with for a couple of reasons. One is they're influential. They have broad population bases of employees, and they can come and open doors that may not ordinarily be open to public health, or more difficult to get into the front door.
Thank you. Next question, behavior modification is often the core focus of improving population health. In engaging diverse community partners, what strategies do you employ to shift the focus upstream on the social living and institutional conditions that facilitate or impede optimal health for all and human potential?
Well, that's another good question. I think one of the things that we kind of repeat that again, because
Sure, absolutely. Let me just, here we go. Behavioral modification is often the core focus of improving population health. In engaging diverse community partners, what strategies do you employ to shift the focus upstream on the social living and institutional conditions that facilitate or impede optimal health for all?
Okay, well, that's a good question. That is a good question. Well, one of the things that we try to do in our, for example, in our partners that we use in our integrated clinic, because we have public health folks, primary care folks, and behavioral health folks, and that is to work in an integrated fashion to use a holistic approach to improving their health and their family's health. So I think using that integrated approach is one way. I think another way is by using the concepts that we use, like in the Accountable Communities grant, when we have the health navigators, and we actually use community health workers in our clinics currently, and they focus what they focus on, or the upstream causes of poor health or the social determinants of health. So I think when you use the community health workers in conjunction with some of your other integrated partners and dealing with your clients and patients, that gives a more holistic and an upstream approach, a more broad approach to improving health. And we're taking the same approach with the systems that we're working towards with criminal justice reform as well.
Great, thank you. I realize we are getting close to time, so I want to be conscious of everyone's time today, but so maybe I'll throw out this one last question. Maybe it can be a really quick question. How long have you been on this journey?
Well, we've been on this journey. I've been the director here since 2009, and so we're going on 9 years. And we've disassembled I think a great team here. We have a great supportive board, and we have some great elected officials, real community-minded leaders that are willing to try something different, and we have a group of really great engaged partners. And so it is a journey. We're certainly not there yet. We've made some progress, but it takes a team, and as you know, it takes a community that's focusing on prioritizing health and wellness, along with the other priorities of education and jobs to be successful. So we're along that journey. We're about 9 years into it, but we've got a long ways to go.
Fantastic. Thank you so much. I think that's a great question to end on. I realize that we didn't get a chance to answer everyone's question today, but we will we'll pull them together and follow up afterwards. So we'd like to end today with just a selection of resources and upcoming events that can support efforts related to performance improvement. And these links should all be live. So if you have downloaded the slides, you should be able to access them from there. So we have a number of resources available to support population health, and have pulled out a couple in the first few bullets here. The first, Solving Population Health Problems Through Collaboration, is a recent book that offers key insights from more than 50 population health experts into how to address population health issues and challenges in a collaborative way. Contributing authors include Gary, who you've heard from today, and you can read more about the Oklahoma City story in his chapter in that book. In addition, one collaborative approach for determining and aligning actions that can be taken across disciplines for achieving community health objectives is the Population Health Driver Diagram Framework. You can learn more about this approach for aligning efforts of public health and healthcare organizations in improving community health and access related resources through the link on the slide. PHF also has a number of quality improvement tools on topics ranging from leadership development and strategic planning through project management and decision making, all available for free download. And the Public Health Improvement Resource Center contains more than 600 resources from a variety of organizations on performance improvement topics. The Academic Health Department Learning Community is a national peer learning community designed to support organizations in building collaboration, specifically between public health practice and academia, and offers opportunities for engaging in discussion, webinars, mentorship, tool development, among other activities. Finally, the Train Learning Network, the largest learning network for public health professionals, provides access to courses in a wealth of topic areas, including community development. And we are also always happy to answer questions about any of these resources or other resources. And you can find my contact information on the bottom of the slide. In terms of upcoming events, we have 2 webinars over the next month that may be of interest. First, we invite you to join us tomorrow for a webinar with the Public Health Accreditation Board and the Council on Education for Public Health, exploring how academic health department partnerships, formal partnerships between health departments and academic institutions, can support achieving and maintaining accreditation. That webinar will start at 1 p.m. Eastern Time. We'd also welcome your participation in the Heart of New Ulm Population Health Takes a Village webinar, which will focus on an innovative heart health program that has successfully reduced heart attacks and improved heart disease risk factors with partnerships across public health, healthcare, education, government, and business. That webinar will be held on March 21st at 1 p.m. Eastern Time as well. Both of these webinars are free and open to all, so please feel free to share the invitation with colleagues who may be interested. And if you have any questions about either event, I've again included my email here and would be happy to answer them. So with that, we would like to thank you once again for joining us today, and Gary for that wonderful presentation. I hope you enjoyed the webinar. Please feel free to explore our website and to get in touch with us at any time, and have a great rest of your day. Thank you very much.